name is Savannah. This is Jenna. Today we're going to go over how to perform a head-to-toe assessment. Hi. My name's Savannah. I'm going to be your nurse today.
Okay.
How are we doing?
I'm doing pretty good, you?
Good. Can you tell me your full name and your date of birth?
My name is Jenna Yans, 2/25/1997.
Good. So now we're just going to go over some orientation questions with Jenna. Make sure that her level of consciousness is good. So Jenna, can you tell me where we're at right now?
We're at the hospital.
Good.
In Grand Rapids.
Okay. And do you remember what brought you into the hospital?
Abdominal pain.
Okay. Do you know what the date is today?
November 1st, 2021.
Good. And then can you tell me who the president is?
Joe Biden.
Okay. And while we're talking about her orientation questions, we're also assessing her speech and communication. So we want to be listening for any signs of garbled speech that could be an indication of neurological issues, or if she was having any hoarseness, that could be a sign of vocal cord damage, things like that. All right, so now we're going to ask Jenna about her pain. So you said you're having abdominal pain.
Mm-hmm.
Okay, could you rate that on a scale of 0 to 10 for me? If 0 was no pain at all and 10 was like the worst pain ever?
I would say it's about a 6.
Okay, and then what type of pain is it? Do you feel like it's a dull pain, achy, sharp?
It's sharp and some cramping as
Okay.
well.
And what portion of your abdomen is that located in?
Mostly in the upper.
Okay. Is there anything that makes that pain any better or that makes that pain any worse?
Not particularly, just resting mostly.
Okay, good. All right. And then we're also going to assess Jenna's abdomen pain a little bit more once we're at that section, but now we at least have a baseline of kind of where her pain is at in this area. Okay, so we're gonna move on to her head. So first we're going to just kind of be looking over her head, her skin integrity, making sure she doesn't have any open sores, any bruising, any bulging, things like that. Her ears are a pressure point, so we want to make sure that we're peeking behind her ears for any skin breakdown, especially since she has glasses on. We want to make sure that there's no irritation going on back there. We're going to take a peek here. Good. Peek on this side. Good. And then after we assess the rest of her skin here, we're going to move on to looking in her ears. So here we want to be looking for any signs of infection, so any drainage that she has in her ears, swelling, tenderness, things like that. Have you had any issues hearing at all lately?
No.
Okay. Good. Okay, next we're going to be looking inside Jenna's nose. We're going to be looking for patency, any signs of infection as well, any excess drainage, or also any dryness that she may have. Have you ever broken your nose before in the past?
Nope.
Okay, have you ever had a deviated septum at all?
No.
Okay. Good. Next, we're going to move on to Jenna's mouth. Here we're going to be looking for any swelling that she may have, any bleeding in her gums. We want to look at her teeth for her dental caries, ask her if she wears dentures at all. And then we're going to be looking at her tongue, make sure that she doesn't have any cracked signs of dehydration, or that she doesn't have any lesions or kind of white patchy areas. That could be a sign of thrush, which is a common fungal infection. All right, so I'm gonna have you open your mouth for me. Good. Can you stick your tongue out? And then I'll have you move it side to side there. Good. So having Jenna kind of move her tongue side to side to make sure that her cranial nerves are intact with that portion. Okay, and then we're going to ask Jenna about her swallow. Have you had any issues swallowing at all lately?
Nope.
Any difficulty with like thin liquids? Any difficulty with certain types of foods?
No.
Okay, so I'm going to have you do a dry swallow for me just so I can make sure you don't have any issues there. Good. So if someone did have issues swallowing certain types of liquids, they may need a speech consult. We want to assess for any signs of aspiration. So if people were coughing a lot when they're swallowing, they could be aspirating that food or that liquid into their lungs, which would make them very prone to infections. So we make sure we're not having any motility issues there. Next, we're going to assess Jenna's eyes. So I'm going to have her take her glasses off for me. All right, so we're going to be looking at her sclera of her eyes, so the white portion. We want to make sure that it's not reddened at all. She doesn't have any bloodshot eyes, We also want to look for any yellowness, which could be a sign of issues with her liver. We're going to look at her pupils for Perla. So we want to make sure her pupils are equal, that they're round, that they're reactive to light, and that they're accommodating. So the first time that we shine the light in Jenna's eyes, we're making sure that each pupil constricts on its own. And then the second time, we're looking for that accommodating effect. So we want to see that if we shine the light in one eye, the other eye is going to accommodate and constrict as well. Good. And then for pupil size, a lot of times the pen lights do have the different sizes of pupils on the side of them here. Otherwise, you can kind of look at an image and kind of gauge the size there, but mostly we want to just make sure that they're round and that they're even, and that they don't seem super constricted or super dilated. Okay, go ahead and put your glasses back on. Now, do you wear your glasses all the time, or do you just wear them for reading or driving?
All the time.
Okay, do you have contacts at all?
No.
Okay, that's a big thing we want to make sure is asking people if they have contacts, so that those don't get left in for too long, or if anything were to happen, we want to make sure that those contacts don't stay in there. Okay, so we're going to move on to Jenna's neck. So first we're just going to inspect her skin integrity again, looking for any signs of open sores, any bruising at all. Looks good. Then we want to check for any swollen lymph nodes. Do you feel like you've had any swelling recently in your neck at all?
No.
Okay, good. So she doesn't seem to have any signs of swelling here. We want to be looking for jugular vein distension. So we want to look on both sides for that. That could be an indication of heart disease, or it could also be an indication of things like a pneumothorax. So anything that increases the pressure in the vena cava can cause that jugular vein distension. So look on both sides here. Good. We want to peek at her thyroid and make sure she doesn't have a goiter or any inflammation right there in her thyroid. And then we also want to look at her trachea to make sure that it's midline and it's not shifted to one side or the other. If Jenna did have a tracheal shift, that could be an indication of a partially collapsed or fully collapsed lung. Good. If Jenna were having any tenderness or swelling at all, we could palpate her lymph nodes, but we won't do that portion right now. We also want to assess her skin turgor, so looking at her elasticity for signs of dehydration. So while we're up here by her collarbone, we're just going to pinch her skin a little bit and make sure that the elasticity is there. Good. Okay, so next we're going to move on to Jenna's arms. So we're just going to inspect her skin first here, check for any breakdown. We're going to look at her elbows, another pressure point here. Make sure she doesn't have any skin breakdown on those bony prominences. And while we're inspecting there, we're also feeling for temperature. Make sure she's not cool, clammy, diaphoretic, anything like that. All right, we're going to have her do some range of motion exercises here just to make sure that her muscle tone's intact. So kind of do a little half circle for me there, good. Then kind of bend your arms up and down. Do you have any tenderness in your joints at all?
No.
Good. All right, so now we're going to palpate her radial and her brachial pulses here. So we'll do that bilaterally. Good. And then we're also looking for any signs of swelling in her arms at all that could indicate a blood clot up here. Moving on to her hands here, we want to look and make sure she doesn't have any clubbing on her nails. That would be an indication of low oxygenation levels. And then she has some dark nail polish on here, but we want to do some capillary refill, make sure there's good perfusion there. So we're going to kind of just pinch on each of these fingers here. Good. We'll do this side. Good. And then we're going to check on her grip strength and make sure that it feels equal bilateral. Good. We want to make sure she doesn't have a deficit on one side more than the other that could indicate signs of neurological issue, things like a stroke. Okay. Do you have any numbness or tingling in your fingers at all?
No.
Okay, so just checking for any neuropathy, making sure that all of those senses are intact. Okay. All right, so we're going to move on to the listening portion of her thorax here. So we're going to start by listening to Jenna's lungs. It's very important that we listen to the anterior, the lateral, and then once we have her sit up later, we'll listen to the posterior as well. So on the left side, we want to make sure we're listening to the upper and the lower lobes. And then on the right side, we want to make sure we're listening to the upper, middle, and lower. May I have you take a deep breath for me? Good. So when you're listening to people's lungs, there's a lot of different noises that you can hear. So I really encourage you to listen to a video that kind of goes over those different sounds. That way you can kind of identify them a little bit more when you're hearing them. So if Jenna were to have any wheezing going on in her breath sounds, that could indicate things like COPD, asthma, bronchitis, kind of a narrowed airway. If she had any rhonchi, that would be kind of a lower pitched wheeze, would also indicate things like COPD or asthma. If we heard any stridor at all when she was breathing, we could check her airway and make sure she doesn't have any blockages there. And then if she has any crackle noises in her lungs, those would be an indication of things like fluid on the lungs, things like infection or congestive heart failure, that extra fluid that could be there. We also want to listen for diminished lung sounds, so kind of just quiet lung sounds in any areas. Those could indicate a decrease in airflow. A lot of times that can happen with things like lung infections or fluid on the lungs as well. So now I'm going to have Jenna sit up. I'm going to listen to her lungs on the back side. Sometimes it's a little bit easier to listen to the lateral portions when people are sitting up as well. And then while we're back here, we're going to peek at her pressure points again, look at her skin integrity. So we want to peek at her shoulder blades and her tailbone, those bony prominences, make sure she doesn't have any skin breakdown. And then we're also going to peek at her spine, make sure there's no skin breakdown on her spine, and that it appears midline. And have you take a deep breath for me? Good, go ahead and lay back. All right, and then we're gonna ask Jenna some questions about her breathing. So have you felt short of breath recently at all?
No.
Okay, have you been having a cough at all?
No.
Okay, do you smoke at all?
No.
All right, and then we also want to be looking for any signs of accessory muscle use or respiratory distress. So if she had labored breathing, if she was using her abdominal muscles when breathing, that could be an indication of respiratory distress. So that all looks good. So we're going to move on to listening to Jenna's heart. We want to make sure that we listen at all 5 points here. So we'll start with the aortic and then the pulmonic, and then we want to listen to the Erb's point, the tricuspid, and then the mitral. So when we're over here at the mitral portion of her heart, that is also where the apex is. We want to be listening to the apical pulse. So that's where you would hear any irregularities. So things like atrial fibrillations, we want to make sure that we listen at that point for her regular heartbeat. We want to be listening for S1 and S2 sounds. If she were to have an S3 or an S4, that apex of the heart would also be where we would hear that, those extra heart sounds. And then we also want to be listening for any heart murmur at all. gonna move on to Jenna's abdomen. So we're gonna start here by inspecting her skin. So we wanna look for any bruising at all, any bulges that could indicate a hernia, or any distension in the lower abdomen could be a sign of an ileus or a bowel obstruction. So you just wanna make sure that her stomach looks symmetrical, flat, could be a little bit rounded, but we don't want it to be distended here. So her skin all looks good, temperature feels good. So you said most of your pain is up here in the upper abdomen?
Correct.
Okay, so it's important that we auscultate her bowel sounds before we do any palpating or percussing, because a lot of times that can disrupt those bowels, so we want to listen before we mess with them. So we're gonna start in the right lower quadrant and then work our way clockwise just to kind of follow the flow of her bowels. Good. So Jenna has bowel sounds in all 4 quadrants, which is good. Sometimes people can have hypoactive bowels where they're a little bit slower. That could be just from motility issues. Or people can have hyperactive bowel sounds, things like extra gas bubbles in there. All right, so next we're gonna palpate. You said your pain is on the upper portion here? Okay, so when we're palpating, we wanna pay attention to where pain may be located in the abdomen. A lot of times that can give us a better indication of what it might be caused from. So if someone were having pain in the right lower quadrant, that's where your appendix is, so that could be a sign of appendicitis. The right upper quadrant is where your gallbladder is located. So I know Jenna's had gallbladder issues in the past, so that could be related to that upper pain. Other areas in the upper abdomen are the pancreas and the stomach, so those could also be related to pain in the upper abdomen. And then if someone is having pain kind of in their lower abdomen or radiating towards their back, kind of like wrapped around their abdomen, a lot of times that pain can be associated with your kidneys. So either kidney infections or kidney stones could be an indication there. All right, so we're gonna go ahead and palpate, starting in the right lower quadrant again and working our way around here. We wanna feel for any swelling, any masses, bulging, things like that. And then we also want to check for any rebound tenderness. So do you feel like kind of when I'm holding that it feels a little better?
A little bit, yeah.
Is it a little more painful when we release?
Yeah.
Okay, so a little bit of rebound tenderness there. Okay, but no bulging, no swelling, things like that. Now we're gonna move on to percussing her abdomen. So when we're percussing, we should hear a dull noise over things that are solid or fluid filled, and like her organs, and then we should hear kind of a hollow tympanic sound over things like her stomach, things that are air filled. Alright, so we're going to ask Jenna some more questions about her abdomen, especially since that's where her problem area is. That's what she came in for. So Jenna, when was your last bowel movement that you had?
This morning.
Okay. Do you feel like it was a normal bowel movement? Was it on the looser end or more firm?
It was pretty loose.
Okay. How many bowel movements would you say you're having per day?
About 3 or 4.
Okay, and those are all pretty loose bowel movements?
Yep.
Okay. Do they appear bloody at all? Do they appear dark, black, tarry?
No.
Okay. Do they look mucousy at all?
No.
No, just kind of brown in color?
Yeah.
Okay. Have you been having any issues with nausea or vomiting at all?
I've had nausea, lots of nausea, and some vomiting with it.
Okay. Do you feel like your nausea is pertaining towards certain foods that you eat, like maybe the fried food versus soft foods?
A little bit more on the heavier stuff, but still some for all of it.
Okay. Do you ever get nauseous with just liquids?
No.
Okay, good. All right, so we're done with Jenna's abdomen there. So now we're gonna move on to the perineal area. So if someone had a Foley catheter, we would make sure that we were assessing that for cleanliness. We could ask them how long they've had it, if it's been changed out at all. For Jenna, we wanna ask about her urinary system. Have you been having any issues with frequency, any burning with urination?
No.
Okay, any odor areas down there?
No.
Okay, good. So looking for signs of infection, any UTI, things like that. All right, so now we're going to move on to Jenna's lower legs here. So first we're going to inspect her skin, look for any breakdown. We're gonna palpate for temperature. Good. She's got some bruising here, but nothing too excessive. A lot of times patients will have bruising from blood thinners, things like that. Okay, and then we want to peek at her bony prominences. So we're going to look at her heels here. Make sure she doesn't have any pressure sores. Good. All right, we're going to palpate Jenna's pedal pulses and her posterior tibial pulses here. Good. All right, and then we want to make sure that we're assessing Jenna's lower legs for any signs of deep vein thrombosis, a DVT. So we want to look for any swelling, redness, warmth, tenderness. So she doesn't have any redness or swelling at all. Have you had any pain in your lower legs at all?
No.
Okay, good. We also want to check for any edema. That could be related to a blood clot as well, or that could be from things like congestive heart failure, where people have a little bit of extra fluid on them. A lot of times they'll take things like diuretics. Usually they can tell you if they are a little more fluid overloaded than their normal, or if it's kind of their baseline swelling. So we're just gonna check for any edema here. Give our legs a little squeeze. Shouldn't have any swelling. We wanna make sure we check people's feet and ankles as well. Good. Now we're gonna look at her toenails, similar to her nails, for any signs of clubbing, which could be that low oxygenation, or we'll also wanna look for her capillary refill, make sure that she has good perfusion and blood flow going here. So her toes are a little cold, but her capillary refill looks good. Okay, and then we're gonna ask, do you have any numbness or tingling in your feet at all?
No.
Okay, that could be a sign of neuropathy. Some people have that numbness and tingling sensation in their feet or their hands, and we wanna make sure that all those sensations are intact. We're gonna check her strength here on her feet, make sure she doesn't have any one-sided deficits here. So can you push for me? Good. And can you pull your feet towards you? Good. So those feel even and strong on each side. All right, so now we're gonna ask Jenna a little bit about mobility. So Jenna, do you use any assistive devices at home when you walk around? Do you use a walker or a cane at all?
No.
Good. Have you fallen recently at home at all?
No.
Not had any falls? And you don't use any, do you have any railings at your house?
No.
No.
I mean, not that I use for walking.
Right.
But
Do you have steps that you go up in your household and you can do those okay on your own?
Yeah.
Okay, good. All right, so that completes our head to toe assessment. Thanks for participating. Hey, you made it to 32.
that's good.